reproductive health. You have learned about a reproductive system and its function in chapter 3. Now, let's discuss a closely related topic, reproductive health. Reproductive health refers to the state of healthy reproductive organs with normal function. According to the WHO, reproductive health can be defined as a total well-being in all aspects of reproduction. That is physical, emotional, behavioral, and social. Reproductive health. You have learned about a reproductive system and its function in chapter 3. Now, let's discuss a closely related topic, reproductive health. Reproductive health refers to the state of healthy reproductive organs with normal function. According to the WHO, reproductive health can be defined as a total well-being in all aspects of reproduction. That is physical, emotional, behavioral, and social. Reproductive and Child Health Program. Major task of RCH programs are creating awareness among people about various aspects of reproduction, providing facilities and support to build up reproductively healthy society, and the measures taken by the government include introducing sex education in schools, statutory bans on amniocentesis, proper information about reproductive organs, adolescents, related changes, safe and hygienic sexual practices, and sexually transmitted disease like AIDS would help people, specifically the adolescents, to lead a reproductively healthy life. Population explosion. Rapid increase in population over a period is the population explosion. The reasons for this population explosion include rapid decrease in death rate, increase in people in reproductive age, and the consequences of overpopulation include shortage of food supply. If the population keep on increasing and the production of food does not increase in similar proportion, will lead to shortage of foods. Unemployment. As the number of people will increase, the job need will also increase, but when sufficient numbers of jobs are not available, this would cause unemployment. Education. With increasing population, more people need to be educated. This creates difficulties for the government in order to provide proper educations to all. Poverty. Family tends to become poor if there are more individuals with less income. Birth control. This birth control is to prevent the contraception. It is a preventive methods or devices that limit the number of offsprings is called as birth control or contraception. Contraceptives should be user-friendly, easily available, effective, reversible with no or least side effect. And this contraception is of two methods, temporary methods and permanent methods. Temporary means used to postpone the pregnancy or space the birth. Permanent means aim is to purposefully and permanently destroy the reproductive capacity of an individual. Temporary methods include barrier method, natural contraception, oral contraceptive pills, injectables, implants and devices. But where is this permanent method? For female it is tubectomy and for male it is vasectomy. Natural or traditional method, that is divided into three: periodic abstinence, coitus interrupts or withdrawal, and lactational amenorrhea. Periodic abstinence means which we avoid coitus from 10th to 17th days of menstrual cycle. And whereas this coitus interrupts or withdrawal mean the male partner withdraw his penis from the vagina just before the ejaculation. Lactational amenorrhea means absence of menstruation. Women have extended breastfeeding so as to avoid a new pregnancy. Barrier methods include condoms, cervical caps, diaphragms and valves, and then spermicidal creams, jellies and foams. Condoms, it is an additional benefit of providing protection against STDs and AIDS. Nirod is a popular condom used by males, and female condoms are known as femidomes. Cervical caps, diaphragms and valves. These are inserted into the female reproductive tract to cover the cervix during intercourse. Semicidal creams, jellies and foams. These are chemical methods used along with the above stated barrier methods to increase their contraceptive efficiency. These are applied at the surface of vagina before intercourse. Intrauterine devices. Devices contain either copper or progesterone and are inserted by doctors in the uterus through vagina. There are three methods. One is copper releasing IUDs. Example, copper T, copper 7, multi-load 375 and Paragard are some of the copper releasing IUDs. Hormonal releasing IUDs. Example, Progesticet, LNG20, Minerina are some of the well-known hormone releasing IUDs. And then non-medicating IUDs, example, Lippis loop. IUDs prevent contraception in many ways by increasing the phagocytosis of sperm within the uterus, by suppressing the sperm motility and fertilizing ability of sperms by releasing the copper ions. The hormone releasing IUDs make the uterus unsuitable for implantation and the cervix hostile to sperms. Oral contraceptives. Preparation of hormones or either progesterone or progesterone-estrogen combination in form of tablets and pills. They alter or inhibit ovulation and fertilization and also modify the quality of cervical mucus to prevent or retard the entry of sperms. They are very popular among urban women. Most common examples are Mala D and Sahili. Pills have to be taken daily for a period of 21 days, starting preferably with the first 5 days of menstrual cycle. After a gap of 7 days during which menstruation occurs, it has to be repeated in the same pattern till the female desires to prevent the contraception. They inhibit the ovulation and implantation as well, alter the quality of cervical mucus to prevent the entry of sperms. Pills are very effective with lesser side effects and are well accepted by the females. Oral contraceptives for the females contains a non-steroidal preparation. It is a once-a-week pill with very few side effects and high contraceptive value. Progesterone alone or in combination with estrogen can be also used by females as injections or implants under the skin. Their mode of action is similar to that of pills and their effective period are much longer. Administration of progesterones or progesterone-estrogen combination (IUDs) within 72 hours of coitus have found to be very effective as emergency contraceptives, as they could be used to avoid possible pregnancies. Hormone injections, implants and emergency contraceptives. Hormone injections are progesterone derivative or progesterone-estrogen combination injections given every 3 months as injections. They release the hormone slowly and prevents ovulation. And the implants. Implants are also called as Norplant, as a contraception method refers to subcutaneous implantation of synthetic progesterone, though these act similarly to oral contraceptives by blocking ovulation and thickening the cervical mucus. To prevent sperm transport, their effective period are longer. One implant is effective about 5 years. Emergency contraceptive are known as morning after pills, if taken within 72 hours of coitus, have been a very effective as emergency contraceptives as they could avoid possible due to rape or casual unprotected intercourses. Their side effects are menstrual irregulation, vomiting, etc. Example, I pill 72. Surgical methods. Surgical methods are also called as sterilization are generally advised for male and female partner as a terminal method to prevent any more pregnancies. Surgical intervention blocks gamete transport and thereby prevent the conception. Sterilization procedure in the male is called as vasectomy and that in the female it is called as tubectomy. In vasectomy, a small part of the vas deferens is removed or tied up through a small incision on the scrotum, where in the tubectomy, small part of the fallopian tube is removed or tied up through a small incision in the abdomen or through vagina. These techniques are highly effective but their reversibility is very poor. It needs to be emphasized that the selection of suitable contraceptive method and its uses should always be undertaken in consultation with a qualified medical professionals. One must also remember that contraceptives are not regular requirements for the maintenance of reproductive health. In fact, these are practiced against a natural reproductive event, that is conception or pregnancy. One is forced to use these methods either to prevent the pregnancy or to delay or space pregnancy due to personal reasons. No doubt, the widespread use of these methods have a significant role in checking uncontrolled growth of population. However, their possible ill effects like nausea, abdominal pain, breakthrough bleeding, irregular menstrual bleeding, or even breast cancer, though not very significant, should not be totally ignored. Medical termination of pregnancy. Intentional or voluntary termination of pregnancy before full term is called as medical termination of pregnancy or induced abortion. Nearly 45 to 50 per million MTPs are performed in a year all over the world, which accounts to 1/5 of the total number of conceived pregnancies in a year. Whether to accept or legalize MTP or not is being debated upon in many countries due to emotional, ethical, religious and social issues involved in it. Government of India legalized MTP in 1971 with some strict conditions to avoid its misuse. Such restrictions are all the more important to check indiscriminate and illegal female feticide which are reported to be high in India. What is the need of MTP? Obviously, the answer is to get rid of unwanted pregnancies either due to casual unprotected intercourse or failure of the contraceptive used during coitus or rape. MTPs are also essential in certain cases where continuation of pregnancy could be harmful or even fatal either to the mother or to the fetus or both. MTPs are considered relatively safe during the first trimester, that is up to 12 weeks of pregnancy. Second trimesters, abortions are much more riskier. One disturbing trend observed that a majority of MTPs are performed illegally by unqualified quacks which are not only unsafe but could be fatal too. Another dangerous trend is the misuse of amniocentesis to determine the sex of the unborn child. Frequently, if the fetus is found to be female, it is followed by MTP. This is totally against what is legal. Such practices should be avoided because these are dangerous both for the young mother and the fetus. Effective counseling on the need to avoid unprotected coitus and the risk factors involved in illegal abortions as well as providing more care facilities could reverse the unhealthy trend. Sexually transmitted disease. Infectious or disease which are transmitted through sexual intercourse are collectively called as sexually transmitted infections or venereal diseases or reproductive tract infections. Gonorrhea, syphilis, genital herpes, chlamydiasis, genital warts, trichomoniasis, hepatitis B, and of course the most discussed infection in the recent years. HIV leading to AIDS are some of the common STDs. Among these, HIV is the most dangerous disease in the world. And some of these infections like hepatitis B and HIV can also be transmitted by sharing injection needles, surgical instruments, by blood transfusion with infected persons or from an infected mother to fetus too. Except for hepatitis B, genital herpes and HIV infections or other disease are completely curable if detected early and treated properly. Early symptoms of most of these are minor and include itching, fluid discharge, slight pain, swellings, etc. in the genital region. Infected females may often be asymptomatic and hence may remain undetected for long. Absence or less significant symptom in the early stages of infection and the social stigma attached to the STDs determine the infected persons from going for timely detection and proper treatment. This could lead to complications later, which include pelvic inflammatory diseases, PID, abortions, stillbirths, ectopic pregnancies, infertility, or even cancer of the reproductive tract. STIs are the major threat to healthy society. Therefore, prevention or early detection and cure of these diseases are given prime consideration under the productive health care programs. Though all persons are vulnerable to these infections, their incidence are reported to be very high among persons in the age group of 15 to 25 years, the age group to which you also belong. There is no reason to panic because prevention is always possible. One could be free of these infections by some simple principles like avoid sex with unknown partners or multiple partners. Always try to use condoms during coitus. In case of doubt, one should go to a qualified doctor for early detection and get complete treatment if diagnosed with infection. Infertility. A large number of couples of all over the world, including India, are infertile. That is, they are unable to produce children in spite of unprotected sexual cohabitation. The reasons for this could be many: physical, congenital, diseases, drugs, immunological, or even psychological. In India, often the female is blamed for the couple being childless, but more often than not, the problem lies in the male partner. Specialized healthcare units could help in diagnosis and corrective treatment of some of these disorders and enable these couples to have children. However, where such corrections were not possible, the couples could be assisted to have children through certain special techniques commonly called as assisted reproductive technologies. The infertility is of two types. One is primary, another is secondary. Primary means couple has never been produced a pregnancy. But whereas in secondary, the woman has previously been pregnant regardless of the outcome and now is unable to conceive. We came to the end of the chapter reproductive health, and I'll see you in the next video. Thank you.